Good afternoon. Today is World Diabetic Day. My name is Dr. Shibobrata Banerjee. I am working in Apollo Hospital, Kolkata as a senior consultant physician in the Department of Internal Medicine. Now today our topic of discussion, working persons when traveling, they are facing lot of trouble, particularly when they are diabetic. So business travel can be exciting, but for those with diabetes and pre-diabetes, it can also be challenging. Irregular meals, airport waits, late night dinners, and sleep disruptions can all send blood sugar levels on a roller coaster. So buffet, social events, alcohol, and even long sitting hours during travel can make glucose control real harder. Managing diabetes while traveling is about planning ahead and making mindful choices. With a few small strategies, it is possible to travel smart and stay in control of your sugars. Because whether it's a work trip or a long flight, your body does not take a break from managing metabolism. So, one issue is very important. Lot of persons who are regularly traveling, maybe it leisure, maybe it business purpose, they are diabetic. Now our focus will be to manage diabetes, to maintain their work schedule. We are getting lot of different questions in our Apollo onlines. So like I am coming to some questions. One important question we are facing: why do work trips and frequent travel make diabetes management more difficult? Now you see, when we are in work trip and when we are having frequent travel, so our food and our rest, these are getting jeopardized. The basic discipline is getting jeopardized. Now there is a science. Now insulin secretion from pancreas is dependent upon your meal, as well as it is maintain a circadian system. So whether you are traveling daytime, whether you are traveling in night time, it affects our insulin secretion and vis-a-vis our blood glucose level. And when it is a regular event, in that case automatically your blood sugar may remain in an higher side or in a lower side, disturbing your HbA1c and your glucotoxicity level. Now another question: what are the biggest mistakes people make while traveling for work that affect blood sugar control? Now biggest mistakes are: mistake. Airport wait is not a mistake. I have to wait for flight. I have no choice. But mistake is when I am waiting, I am taking repeated coffee, I am taking repeated tea, I am smoking, or for some passing time I am taking 2 bottles of beer. Sometimes I am taking meal which is not expected and which is not related with your sugar control medicine or insulin. So these are the mistakes which we may avoid during our trip or travel. Now the third question: how can someone with diabetes plan for long airport waits and unpredictable meal times? So when suppose you have a transit flight, you have to wait for 6 hours or 12 hours or sometimes 18 hours. In that case, in every airport, international or domestic, you have a system to take rest, particularly in supine position. That means in a proper sleeping position. Now, hormone secretion and blood sugar control is also having a very good relation in which position you are taking rest. So it is better if you can manage one long seat at least to be straight horizontally. Another question, are there recommended travel snacks or habits that help keep sugar stable during travel? Of course, we will try to take those snacks from dietitian which are usually not affecting blood sugar much. It must be less sugar based, it must be having items which are having low glycemic index. I am giving you one example. Suppose you are taking a snacks of potato chips. Now, if you take 2 packets of potato chips and one small bowl of cold drink, then your blood sugar automatically will not be controlled. So, our snacks will be such which are having very low glycemic index. Another question I am getting, work dinners often happen late and involve rich food. What is the solution? Now see, for any diabetic patient, basic meal habit, what will be the basic meal habit? It should contain more vegetables, it should have fibers, it should have less oil. For taste, you may add some spice and less carbohydrate, less fat or oil and more protein. This is the basics. These are the basic, and if possible, salt content should be low, potassium content should be high, because very often diabetic patients are related with hypertension. So our food should be high vegetable, high fiber, low carbohydrate, high protein, low fat diet. Now another question, buffet can be overwhelming. What are the best strategies to make balanced choices? First, we have to understand during buffet buffet is always exciting, but from our core of the heart, we have to learn to tell no, I shall not take. That is the most important. In Indian cuisines, whenever in most of the airport buffet, if you go, you will see there is a platter of biryani, there will be a platter of tandoori, veg or non-veg, whatever. But again, we have to, and of course, a platter of desserts, lot of desserts are there, and all are sweet, having very high glycemic index, and definitely ice cream will be a part. So, and cold drinks as much as you can take. So during choice of buffet food, you have to keep it in mind, you have to take more vegetables, salads, fruits, much protein high, no problem, less carbohydrate, almost very restricted oil or fat. This is the basic things you have to remember, and you will try to avoid cold drink, ice cream and cream based foods, chocolates, all these you will try to avoid it from buffet. Now another question, how does alcohol affect blood sugar, especially in people on diabetic medication? Now see, regarding alcohol, alcohol is not contraindicated in diabetes mellitus, but alcohol is not indicated in uncontrolled blood sugar. Very important, very important, alcohol is not indicated in uncontrolled blood sugar. So when our blood sugar is not stable, we should not take alcohol. Now among alcohol beverage, which is to be better avoided? Beer. Beer better to avoid because it has a very high content of sugar. Better to avoid. How much we will drink if we are interested when our blood sugar is settled? Better to take less than 100 ml of drink in a day when you are traveling. But again I am telling you, alcohol is injurious to health. We should take it judiciously, whatever drink we are taking. Another question, why is smoking particularly risky for diabetes? There is no single point to support smoking. Okay, so smoking is 100% not indicated in diabetic and non-diabetic patient. Jet lag, late nights and poor sleep, quick recovery tips to help reset body. Now, see, jet lag is a time-bound phenomena. You have to give some time to recover from jet lag. There is no such medicine which will help you very sharp. Hydrate your body, take fluids properly, and try to take sleep. That's all. What is your one golden rule for people with diabetes to remember while traveling for work? When we will travel and we are diabetic, suppose I am diabetic, when I am traveling, I have to keep it in mind, no smoking, restricted alcohol, regarding food, much vegetables, less carbohydrate, high protein, no fat, and hydrate yourself. Thank you very much, and try to be healthy, particularly during travel.